Tell us a little bit more about health coaching and your personal research. I know we're going to get the CPT code at a later stage. How different does a patient respond or a client respond when they've got a functional medicine doctor that's working with a health coach and the patient or the client embraces that health coach? Tell us about your personal experience of the many, many years. What are the differences between the coached and the uncoached?
Yeah, it's a big difference. There are always going to be a small percentage of people who don't need coaching. These are the highly self-motivated folks. They're the 6% you mentioned, that they're already doing the right things. And they're just that type of personality that doesn't need the external support and accountability in order to follow through with their own health goals or whatever their practitioner tells them. So but that's the extreme minority. We know from the
Exactly.
statistic that you just mentioned that's probably around 5% of the US population, and I suspect that it's even lower than that, because that 5% was just engaging in the top 5 like basic health behaviors. They're not necessarily doing everything right. They're just not smoking, not drinking excessively, maintaining a healthy weight, and doing a few other things that are just what I would consider to be the basics. So for the other 95%, we know that behavior change is hard. And there are lots of reasons for that. There are evolutionary reasons for that. We have biologically, our brains are wired to live in a different environment than we live in today. So one example would be our brains are programmed to seek out highly calorie dense, rewarding foods. And when I say rewarding, I mean, that's a psychological term that when we eat something that's rewarding, we want to eat more of it. So we're programmed to seek out salty, sugary, fatty foods because that programming actually helped us to survive in an environment where food scarcity was a much bigger problem than food abundance. If our distant ancestors living in the Paleolithic era, if they discovered a beehive with honey, they would eat as much of that as they possibly could because they had no idea when they were going to encounter that again. And that would actually help them to survive in that type of environment. But when you've got convenience stores on every corner and fast food restaurants on every corner, that drive to seek out that, very calorie dense, rewarding food backfires. So that's just one example of how in the modern world, we're kind of fighting against our default evolutionary programming that, while it protected us and helped us survive in our ancestral environment, it actually works against us now. And that's very powerful programming. We're talking about stuff that's below the level of conscious thought, and it's just always operating in the background. And it's really difficult to work with that. So, people who have support of a health coach are much more able to recognize the influence of those factors on their behavior and the choices they make, and they're much more able to overcome those obstacles and challenges. So, and there are many other challenges too, just in terms of the way most of us are living now. Like I said before, a lot of folks are really busy. They have lots of other obligations in their life: family, work, childcare, personal stuff going on. And a health coach just having someone to, again, be their ally and their advocate, someone who has no other agenda than helping them to succeed, is such a powerful role. And so the people who have embraced that and have really worked with the health coach, what the feedback that we get is they can't even imagine, doing what they're doing without that support, because it just becomes such an essential part of the process.